Okay, so the particulates that firefighters experience can cause like long-term trauma to the lungs. The same thing that, like exploring, we know from the lunar missions that there was a lot of lunar dust that contaminates the environment that the astronauts live in. So if you inhale those particulates, what does that do to the lung epithelium over time? And if they get lodged in the respiratory, bronchioles or down in the alveoli, there's going to be an inflammatory response that ensues. And we're going to talk about inflammation today, so it's somewhat relevant. So this proposal with NASA that hopefully we'll get, but we've been trying for a little while to get this grant, is to try to understand what long-term exposure to nanoparticles that would be either lunar or asteroid dust in lung epithelium of astronauts, what that's going to do. And so presumably we'll see chronic inflammation, and you'll see issues associated with emphysema-like symptoms, chronic bronchitis-like symptoms. So it's not good. It's not good stuff. All right. So before we get started, why did the football coach go to the bank? Get his quarterback. Very good. Monday Night Football started this week, so that's a relevant one. What asks no questions but has to be answered? What asks no questions but has to be answered? The doorbell. And what kind of dance do mothers like best? Anybody? The mamba. All right. So this is where we left off. This is where we're going to pick up. But we will, I promise, we will get to inflammation today. What I want you guys to take a peek at right away is that we're going to start taking a look at the different manifestations of cell injury. Basically, how cell injury looks, what's going to transpire. And these manifestations are cellular accumulations or cellular buildups. So we've talked about water, right? These cells, they get injured and they take on water. What happens when they take on water? What do they do? They swell, okay? That puts pressure on internal organelles, and that might compromise function of like the Golgi apparatus or the mitochondria for making ATP. We see a lipid change. We looked at an example with what tissue? With fatty change. Liver, okay? So that was an alcoholic hepatitis or a cirrhotic liver histology that we looked at last time. We're going to see things like glycogen and proteins. We talked a little bit about those as well. We saw some of those complicated flow charts that we walked through very slowly. Do you guys remember those? If you felt that was a little too fast, even though we went pretty methodically through it, the lecture from Monday's already posted. You can go fast forward to the very end, and that's where we talked about those mechanistic slides. Okay, another advantage of having the recording is if you, like me, need to digest mechanisms a few times, that's one of the best ways to do it. We explained it once, it's recorded, you can go and rewind and listen to it again and follow exactly all the different flow charts. Do you guys think that there might be a question or two on the exam about those flow charts? Yeah, for sure. A lot of great places to write test questions, okay? So right now we're going to look at pigments. We didn't get to pigments, that's where we left off. And so on this slide, straight up, we're going to talk about hemosiderin and Lipo Fusion. So hemosiderin is really from the uptake of iron. So you see this in bruises. The slides here are two different pictures of the liver. So the upper right and the lower left. The upper right is showing sort of the brown punctate stain that you see is iron that's found in the liver. This is normal. Both of these pictures are normal liver. You would expect to see the liver containing iron because of the recycling of iron that takes place in the liver. And so this is a brown stain up here that shows the iron kind of in this like new looking kind of orangish brown punctate stain. Down here is what's called a Prussian blue stain, and this one I like a little bit better. This is also liver, normal liver, and it's showing kind of the punctate blue dots where the iron is located. Now, where would you find it pathologically other than the liver? You might find this like in muscle tissue from a bruise. Okay, you'll see a lot of hemosiderin. If you've ever fallen or run into something and you get a bruise, that bruising is that extravascular blood that shows up, and the discoloration that takes place over time is the hemosiderin. Okay? So if cells get damaged, like you get a muscle bruise, you'll see hemosiderin in that area. Then the second one is called Lipo Fusion, and Lipo Fusion is this lower right image. And Lipo Fusion is showing up, this is actually muscle tissue, this is cardiac muscle, and you can see the striated patterns, you can see the intercalated discs every so often, like right here and right here, and then these arrows are actually pointing to Lipo Fusion. And Lipo Fusion is a lipid material that is indicative of degradation of organelles, cellular parts. And so it's a wear and tear marker. So the older a patient gets, the more Lipo Fusion you would potentially see in the tissues. So this is another example of how under autopsy, you know, a coroner wants to identify a body and somebody went missing, and you know, they'll use dental records. Well, they'll collect all the organs. Remember I said they would weigh the organs to see maybe cause of death? And if the liver was 3 times the weight or the mass that it normally would be for that age of a patient, then they might suggest, oh, something could have happened with the liver. Maybe it was trauma, maybe it was liver failure. And so the other thing that they could do is they could look at the heart, and they'll ID and say, okay, well, we think this was, you know, a John Doe that was 75 years of age, but we've got another missing John Doe that's like 18. Well, they take a look at the heart, and they can tell really quickly the 18-year-old isn't going to have really any Lipo Fusion in their cardiac muscle, because there hasn't been enough time for organelles to wear down. But a 75-year-old has a whole lifetime of cardiac cycles, and so you'll see higher levels of Lipo Fusion. Does that make sense? Okay. So just another example of cell injury. And again, I'm using this age of an 18-year-old and 75-year-old to kind of prove to you that age is an example of a disease. So actually, Monday I misspoke. I said we covered three diseases on Monday, right? We labeled them. We said Barrett's, we said peptic ulcers, and then what was the third one? What was it? Emphysema. Well, we actually introduced a fourth one too prior to that, which was age. I forgot about that. So kind of reintroducing age is one of our disease states that we've already looked at, just to remind you. So the other thing that we can see are calcium accumulations. And calcium accumulations are found kind of in 2 flavors. Maybe that's a horrible, you know, terminology to use with the picture that's sitting up on the screen, but 2 different varieties. So we've got calcium accumulations that will occur as dystrophic, found in dead or dying tissues, like in a tuberculosis lung that we looked at on Monday, or it might be in an atherosclerosis plaque that we're going to look at the very end of the semester, okay? That's dead and dying tissues. The other one are metastatic examples. Metastatic examples are usually associated with problems associated with hypercalcemia. So you get too much calcium in the bloodstream, so you get deposition of calcium in undamaged tissues where it's not supposed to be there. So the picture that we show here is actually dystrophic disease of calcium, and we've got aortic valve stenosis. So this is the aortic valve. That's the valve that, you know, essentially separates the left ventricle from the aortic arch, the rest of the body where the blood is pumped out. And the pressure inside the left ventricle has to exceed mean arterial pressure for that valve to open. It's a one-way valve. And when that valve opens, blood flows out, and then it's a one-way valve, so when the blood pressure comes back on it, it closes completely. Well, you can actually appreciate in an older patient, you've got all of this white, sort of chunky, rock-like architecture, which is your dystrophic calcium that's showing up in these aortic valves. And that results in what's called aortic valve stenosis, meaning that aortic valve is no longer going to close completely, and you're going to get some back pressure leakage. And you have sort of an insufficient aortic valve, and a lot of times those valves will have to get replaced, or the patient will go into heart failure. For those of you that like these kinds of gory pictures, this is foreshadowing what we're going to talk about at the end of the semester in our cardiovascular lecture. But we do a lot of this kind of research in one of my off-campus laboratories. Well, we'll get human samples, and usually we're getting questions from medical device companies like, hey, we had our device in this patient and it didn't work well. Please tell us what went wrong, okay? So we'll get a lot of atherosclerotic blood vessels, and we'll literally have to, they're like a tube. And you take a razor blade and you cut them longitudinally, and then you open them up. Imagine taking a straw and then running a knife down the edge, and then trying to flay it open and pinning it down. And when you make one pass through these atherosclerotic vessels that look a lot like this, if you look at the edge of your razor blade, it's completely jagged. Like, this is literally like stone. It's like it'll crunch. It's like crunchy. It's like really amazing at how solidified these calcium accumulations can be. Okay, let's do a couple of review-like questions that could be preparation for the exams. Definitely, or they could be preparation for the post-quizzes. We have 2 post-quizzes this week, right? You've got post-quiz 1 and post-quiz 2 that are due when? Friday by 11:59 p.m., okay? So before you go out, make sure you take those quizzes. All right, the gross appearance of the myocardium shown here from a 58-year-old man who is admitted with chest pain is most consistent with which of the following microscopic changes? Liquefaction necrosis, caseous necrosis, fat necrosis, coagulative necrosis, or apoptosis. So there's a couple of key phrases in the question that you definitely want to pick up on, right? So let's digest the question. It's more important that you understand like how to read the question and how to take the question that I would write versus what's the answer at this point. Okay, some of you are like, all right, I know the answer. But let's walk through it together. So label some of the key phrases in the question. Key words. What is it? Myocardium. I heard myocardium. That's a key phrase. Okay. Anything else? He's 58. Okay, so he's young, right? My hair's like, what? Trust me, the older you get, the younger ages look. Microscopic. Okay, that's a key word. So I'm showing you a gross picture, but yet I'm asking a microscopic-like question, right? Okay, so which one could you eliminate right away? Apoptosis. Why do you know it's not apoptosis? It's not programmed. Is there any information in the question that leads you to believe that this is programmed cell death? So let's eliminate apoptosis. Now you got 4 different types of necrosis, right? Eliminate one for me and tell me why you eliminated it. What's that? Liquefaction? Liquefaction necrosis. Why? I agree. Eliminate that one. Why? Wrong organ. It's definitely more of the brain. Okay, great. What's another one you can eliminate? Why? What's that? Fat necrosis. Is the myocardium fatty? No. Now, if you open up the chest cavity in a human, it looks yellow. Like the chest. Has anybody seen an open chest? And you see down, it looks yellow. It's disgusting, isn't it? Huh? Highlighter yellow, yeah, you're just like, where's the heart? It's like, oh, that's it right there. It's covered in fat. But we're talking about the myocardium, which is not the outer layer of the heart, okay? Okay, so you can eliminate fat necrosis because there's no fat in the myocardium. So now we're left with coagulative and caseous. right? So this is an example of how a test question or a quiz question might be like on Fridays. You'll probably be able to get down to two answers relatively quickly. And then this is where the hard work comes, right? So how are you going to discriminate between coagulative and caseous? Any suggestions? Let's go with which one do you think it is and why?
I was going to say coagulative.
Coagulative because it's the heart. I would agree with that. If I wanted to double check myself, why do I think it's not caseous?
It doesn't really occur because the caseous occurs in open spaces
More in open spaces, like what tissue?
lung.
Like lung, lymphatic tissue, okay? So now you're feeling pretty confident about coagulative, which is the right answer, but you're kind of at a 50-50. So it's nice to have confidence that you know what the answer is, and then confidence that you know the other answer is probably wrong because of this reason. Does that make sense? Okay. All right, should we try one more? Oh, never mind. Just kidding. Well, the good news is you can try 10 more by Friday. How's that? That's just getting you. So you guys are all excited to do more, right? All you gotta do is log in.